I lost my mom when I was 21 years old to the consequences of 3 consecutive breast cancers. My older aunt, her mom, passed away from breast cancer. The other sister, my other aunt, passed away from breast cancer. And I was the next one. So I got introduced to Dr. Naroons, who is my medical surgeon. We looked into the gene history of the family, and Dr. Naroons agreed with the idea that a bilateral mastectomy, in my case, was probably a good thing to do.
Choosing prophylactic mastectomies. This is a very major decision. When that's their first choice, they talk to multiple people on our team and that we really are sure that that's what she wants and that's what she'll be happy with long term. And that certainly has been the case for her.
Breast reconstruction covers any patient who has a mastectomy for medical reasons. So sometimes that's for breast cancer, but sometimes it's for precancer. Sometimes it's prophylactic, meaning you're doing it before the patient has cancer.
The Women's Health Cancer Rights Act of 1999, which protects women with breast cancer, mandates that insurance companies cover reconstruction as well as the symmetry procedures associated with their diagnosis.
Once we decided to go with at least the idea of a bilateral mastectomy, Dr. Naroons, the medical surgeon, introduced me to Dr. Liu, and he explained to me what the process would be. A primary surgery at Camino hospital to remove pretty much everything that could create a problem later, so just leaving the skin, conserving the nipple, which I was not aware was doable in my case, so that was a very precious information.
Valerie was one of the first to have a nipple-sparing mastectomy at Camino Hospital. The ability to save the nipple along with all the skin of the breast yields a far superior breast reconstruction result than the traditional methods. That in and of itself is probably one of the greatest advances in the last 5 to 10 years.
We also now have fat grafting, which utilizes the fat cells to help rebuild the breast and actually provide some soft tissue thickness that may have been lost during the mastectomy that we never had before. And that's a nice complement to traditional implant-based reconstruction. And there is also using the patient's own tissue or autologous-based reconstructions.
The care that I received also from both doctors and from the staff at El Camino was phenomenal.
The staff and nurses at El Camino Los Gatos have been specially trained to care for the needs of the breast reconstruction patient. And the facilities there, from the private rooms and the attentive nurses, have really kind of helped with patient recovery.
You come out overall in a much better mental health, so to speak, still looking the way you were looking before.
Treating breast cancer is taking care of the cancer side, but we're trying to treat the complete patient, and breast reconstruction is essential towards the healing process.
One of my patients summarized it really well by saying it's something that they see every day in the mirror because it's such a cornerstone of their femininity. So if we can hide the scars and repair that part of their body that is so important in defining a female, I think that helps heal the patient.
I feel great. I sleep much better at night. And overall, the process, once you have the right information and you're dealing with the right people like Dr. Naroons and Dr. Luz, is pretty straightforward. It's a matter of being a little bit patient with your body for 6 months. But after that, you're back on the street and nothing has changed, only for the better.